In 1953, after researching in his University of Pittsburgh laboratory, Jonas Salk released his inactive polio vaccine. While researching his vaccine, he exchanged ideas with his mentor, Dr. Francis Jr., encountered criticism from the scientific community for his work, and explored a new type of vaccine. 165 people contracted polio a day. The population with polio was rising even faster than the population in the height of the baby boom. His vaccine is helping to eradicate polio around the world today. It is also being used in America because it is safer than the oral vaccine. His vaccine is helping put an end to a disease that once terrorized the world. If not for his vaccine, vaccines such as hepatitis A, hepatitis B, and rabies would not have existed.
I worked in his laboratory at the Salk Institute in Hoya, back here in Hoya, California. And so I got to see him up close in the laboratory and with the work that he was doing. And his attitude always was that when you're doing an experiment, you're asking a question of nature, and nature's going to give you the answer. Mm-hmm. So the phrase he used was that the answer pre-exists. What we have to do is to figure out what are the right questions to ask.
Poliomyelitis is a highly infectious disease caused by a virus that lives in the throat and intestinal tract that invades the nervous system. Polio is most often spread through person-to-person contact with the stool, oral, or nasal secretions of an infected person. Less than 1% of polio cases result in permanent paralysis of all limbs. Of those paralyzed, 5% die when paralysis strikes the respiratory muscles. Paralysis can lead to permanent disability and death. Early symptoms of polio include nausea, headaches, fevers, muscle and back pain or stiffness. In 99% of cases, the disease progresses no further, but in the other 1% of cases, it leads to paralysis or death.
Jonas Salk was born in 1914, and in 1910, polio outbreaks became common in the developed world. When Jonas Salk was a kid, his mom, Dora Salk, wouldn't let him go outside because polio was rampaging around the slums that he was born in. Jonas Salk was held to high academic standards, which led him to study at the highly selective Townshend Harris High School. After high school, he studied medicine at the New York City College. He studied under a professor, Dr. Francis Jr., in which he got interested in virology and epidemiology. He would delay graduation a year to do an internship in which he would do research with Dr. Francis. Before Salk defended the world against polio with his groundbreaking vaccine, he begged Dr. Francis to allow him to help create a vaccine against influenza for the U.S. military. Dr. Francis told the military that Salk was necessary to his research of the virus, and the military paid Salk to assist Dr. Francis. Salk and his wife Donna drove to Ann Arbor, Michigan. He and Francis developed a theory, the inactive viral vaccine. In the fall of 1942, Salk and Francis conducted a clinical trial at Ypsilanti State Psychiatric Hospital. They inoculated 200 patients total, 100 patients with the actual influenza vaccine and 100 patients with saline. Salk and Francis took blood samples before and after the vaccine. 2 weeks after inoculation, they exposed those same 200 patients to the influenza virus. 16% of those inoculated with the vaccine caught the virus, compared to 50% of those who did not get the vaccine. Jonas and Dr. Francis justified these tests because without these tests, thousands of soldiers would die of this virus without an effective vaccine. After moving to the University of Pittsburgh, he was recruited by the March of Dimes Foundation to start work on the polio vaccine.
I think what he was wanting to do was two things. First, there was a significant problem with polio. A lot of people were suffering, there was a tremendous amount of fear, and a vaccine was absolutely necessary. So his desire was to be able to address that problem as quickly and as effectively as possible. Mm-hmm. So that was the primary thing that was driving him.
Yeah.
The second thing that was driving him was that when he was in medical school, mm-hmm. he had a professor who said in one class that it was possible to inactivate some chemicals that would allow you to make vaccines against a couple of different bacterial diseases.
Uh-huh.
But then in the following class, he said that you can't do that with viral diseases. In order to create a protective immune response against a virus, you need to have a live virus. My father just didn't understand why that should be the case.
Yeah.
So that was the second thing that was driving him. He went to work while he was in medical school.
When he moved to the University of Pittsburgh, he planned to continue researching the influenza virus on his own. The March of Dimes Foundation recruited him to find a vaccine for the polio virus. The March of Dimes Foundation was created by Franklin Delano Roosevelt, who was a polio victim himself. He was paralyzed from the waist down and would have to wear special devices to allow him to stand and address the nation. Salk was recruited in 1947 and would start field trials for the polio vaccine in 1951. Funded by the March of Dimes Foundation, with full control over the University of Pittsburgh laboratory, Jonas Salk started his conquest over polio. There were other researchers at the time working on the polio vaccine, but they were trying to understand how the virus worked, while hundreds of people got polio a day. In 1953, he began his clinical trials. He started with people already affected by the polio virus and made a vaccine for each of the 3 strains. He administered the vaccine to each of them and measured their antibody levels before and after the administration of the vaccine to see the effectivity of the vaccines. He knew that if they were to catch the virus from the vaccine, they would not be further injured because they were already affected. Once the vaccine had been proven effective in those children, Jonas Salk started to conduct the largest field trial in medical history, starting with his own family. 2 years later, in 1955, the results of that trial were released as a success. This startled the scientific community, which doubted the capabilities of the vaccine.
While Albert Sabin's oral polio vaccine, a live viral vaccine, was in field testing, it had a higher infection caused by vaccination than the inactive polio vaccine. Meanwhile, both vaccines caused equal immunity. The Salk vaccine was released and in commercial use 2 years before the Sabin vaccine was in testing. As a result, the early conquest of polio was due to Salk. The scientific community thought the way Salk created his vaccine was not only incorrect but risky to the people who'd received it. But in all reality, Jonas Salk's vaccine was safe and effective. The immediate impact of the inactive polio virus was that it dramatically reduced cases of polio each year. Salk's polio vaccine was in commercial use 6 years before Albert Sabin's oral polio vaccine. While decreasing the amount of polio each year, he started to look outside of the U.S. He looked to less fortunate countries that polio was terrorizing. He even shared it with the sworn enemy of the Cold War, the Soviet Union. During his look to eradicate polio around the world, polio was eradicated in the United States in 1979. This vaccine not only started to save lives, but it was uniting sworn enemies. It still affects us today with the global effort to eradicate polio. The inactive polio vaccine has become the #1 vaccine in first world countries. The polio vaccine and the creation of the inactive virus vaccine led to the creation of other vaccines such as hepatitis A and B and rabies. These are vaccines that were created since Salk's invention of the inactive viral vaccine. These vaccines affected thousands of people each year.
At the height of the 1950s polio outbreak, Jonas Salk created a legendary vaccine. This vaccine will change the world in the way we make vaccines. We are still using this legendary vaccine in today's practical world. The polio vaccine was not only life-saving, but also easy on the wallet. Jonas Salk explored the realm of the inactive viral vaccine while exchanging ideas with his mentor, Dr. Francis Jr. He encountered criticism from the scientific community for his work, his motives, and for daring to make his dreams a reality. Jonas Salk, who was a selfless man, made a vaccine that would become legendary.